Hello everyone, this is Dr. Munawar Sheikh from MS Homeopathic Medical Center, and today we'll talk about polycystic ovaries, which is very commonly heard of today, and it is also one of the major reasons for infertility in women, not just in India but globally too. So, what is polycystic ovaries? It is a condition which is characterized by formation of small cysts in the periphery of the ovary or in the central stroma of the ovary due to hormonal imbalances and various other reasons. It can occur from the age group of 14 onwards till about 40 years or so. And the main etiological factors are: one is the hormonal disturbances. It could be because of nutritional deficiencies, it could be because of hereditary factors, it could be because of lifestyle changes or dietary changes, it could be because of thyroid-related disorders in specific. It could also be because of a lot of other pre-existing conditions like diabetes and maybe possible intake of certain drugs which may indirectly influence the female hormones. And these are the common factors which normally can cause polycystic ovaries. Now, what are the signs and symptoms? How do you know that a person is having polycystic ovaries? First and foremost, we have people who come with complaints of irregular menses, where they have not got their periods for about 3 months, 6 months, or more, and or maybe the cycle is very irregular. It's like a 45-day cycle to a 60-day cycle, where the patient would want to have a like a normal regular cycle, and there would be associated symptoms like excessive facial hair growth, excessive weight gain. I mean, even if the patient is not eating much, but still there is a lot of weight gain that happens. Difficulty in losing weight easily. Also, loss of hair on the scalp, and the quality of hair on the body changing from fine to coarse. Apart from that, they could be associated sense, lethargy feeling and hot flashes, which happen, if in thyroid-related cases as well. So, apart from all these things, the most commonest thing is acne. And there's a lot of outbreak of acne that happens on especially the cheek area and the chin or the forehead area, and it can develop into very bad cystic acne as well. So these are some of the common symptoms that are prevalent in polycystic ovarian cases. Now, why this is so important to treat is because this can lead to furthermore complications of developing into a tumor, or it can develop into a very bad scenario for a lady. She will not be able to conceive. So these are some of the things, the major complications that can occur, immediate complications that can occur. Let's not go further more detail into the other deeper complications. Now, what are the lab tests that you need to do? How to find out through the lab and through your reports? So first and foremost is your ultrasound sonography for the abdominal pelvic area to rule out any other anomalies or pathologies, and also to understand the size of the cyst, and so that you can plan your treatment accordingly. And your thyroid reports, your FSH, LH, Prolactin, DHEA, multivitamin and multimineral blood tests like vitamin D and vitamin B12. Apart from that, you can also do a serum insulin to understand if there is any kind of insulin resistance that you're having. And if by chance the patient is obese, and it's always better to do a LFT or lipid profile, and specifically also do an abdominal scanning then to rule out any fatty liver as well. And now coming to the solution, how do you cure polycystic ovaries? First and foremost is a very good diet, which is well balanced, which is less in carbs, less in fat, less in oily food, and less in sugar. You can go for having a change or shift in your lifestyle. That is, you can have more of walking and active life, doing some exercises or joining some aerobics or dance classes, or at the same time keeping yourself flexible, doing some yoga asanas, and which will help you to have a control over your weight and also help you lose weight gradually over a period of time. You can also ensure that you have um, wholesome grains, fruits, vegetables, and plenty of water to keep you going. So these are some of the things I would suggest people normally. And you don't have to be disappointed that polycystic ovaries is not curable, as some people claim, or some people claim that polycystic ovaries is it just disappears once you get married. Well, it's not so the case in most of the patients, because we do have clients who are already married and they were told so, and still they continue to have PCOS. And once they take the treatment, they are much better and they are cured of the PCOS. So if you really need help with your polycystic ovaries and need to understand it better and how to handle it better and root it out, please do contact us and do not hesitate to discuss your problem with us. So hope you had and got some information with regard to polycystic ovaries and how it can impact your fertility. So to get treated, please do reach out to us and call us on 9741711897 or 8073509711. Thank you for listening. Have a great day. Hope you like and subscribe to our